Welcome to Educators Podcast, a podcast dedicated to budding medical educators. Hi, my name is Swapnil. I work as intensive care specialist in Sydney, and it's my honor and privilege to have one of the new celebrities of Meded world from down under, Dr. Ben Symon. Ben Symon is a pediatric emergency physician and simulation consultant at Queensland Children's and the Prince Charles Hospital in Brisbane. He is a co-founder of Simulcast, a podcast and blog on simulation education, where he facilitates an international open access journal club on sim literature. He has recently joined as an international faculty for the Debriefing Academy based in Calgary. And before doing medicine, he has completed a Bachelor of Visual Arts in Animation at Queensland College of Arts. He finds true joy in translating lessons from publication to coal-face clinicians and educators. It's my pleasure to welcome Ben Symon. Welcome, Ben.
G'day. Thank you so much for that really lovely introduction. I really appreciate you having me along.
There is kind of something special in that introduction that you have completed the Bachelor of Visual Arts in Animation at Queensland College of Arts. Now, tell me a little bit more about how then you switched your career from visual arts to medicine.
So there's two parts to that. The first is I wasn't very good at visual arts. So I had really wanted to be an animator as long as I could remember in sort of primary school and high school. And I was really lucky to get in to a small course in Brisbane that taught it. I think as I went through, I could see that the incredible, sheer, intense talent of my colleagues was vastly outshining my own. But secondly, I think I realized that I wanted to do something a little bit more, I guess, philanthropic, being 19 and all. And so I actually went and after I'd finished my degree, I worked in Swaziland for 3 months at a deaf school. And I was just teaching the kids there, but I happened to be living with a GP who did cataract surgery. And he invited me along to come and take some promotional photos for fundraising and got me hooked into medicine, and I switched across.
Wow, that's quite fascinating. And I guess the topic today that we have chosen is pretty much close to your heart. And obviously you got expertise in this topic, and I'm following you on Twitter and Instagram, and it seems that you're pretty good in art. So I really don't agree with you that your assumption that, you are not good in arts, that's why you switched to medicine. I think you're pretty good in both sides, I guess.
It's actually been really fascinating how helpful that degree has been, given it was pretty challenging starting med school actually with a Bachelor of Animation behind you and no science since about grade 9, but it's really paid off in lots of unexpected ways.
Absolutely. I've found myself quite mentally challenged with arts. I can't draw anything, even the straight line. So when I see people like you who are in medicine but can do these amazing things, I'm pretty jealous with people like you.
Oh, well, you're very kind and very generous.
So the topic today we have chosen is the role of infographics in medical education. And it's a pretty hot topic. And as I said, a lot of budding medical educators want to know about this topic, and they really probably want to try into this field. And obviously you are quite expert in this. So can you just tell us about what is infographic?
Yeah, sure. So look, at its heart, infographic as a term is essentially just a mashup of information and graphic. And one of the best definitions I'd read is from a book called The Power of Infographics by Using Pictures to Communicate and Connect with Your Audience. And they define it quite nicely as visualizations of data and ideas that try to convey complex information to an audience in a manner that can be quickly consumed and easily understood. And to me, I think that streamlining and simplification and translation is really at the heart of this new sort of burst in interest in infographics. Essentially, we're really translating information, often from a numerical or a text-based document, into something that's really inherently easier to digest and process. And popular infographics are often eye-catching, quick to read, and offer a really streamlined and efficient visual summary of sometimes quite complex information. And I guess with the rise of SMAC and a lot of other new media type influences, we've developed, an understanding of some important visual principles with regard to simplifying the data that we give people, even if it's in like a good PowerPoint slide or on a conference poster. But I think in particular with the rise of the healthcare education community on Twitter, we see a lot of infographics now that have clearly been designed to be shared specifically on social media. And I think it's a very clever way of utilizing existing social networks to rapidly share information and hopefully improve translation of research to a worldwide community in a much shorter space of time. I think for myself, infographics are a really fun way to combine some creative energy as well as sharing some passion about topics that might interest us. But they're also actually, one thing that I think is undervalued is that they're a really fantastic tool for teachers in that in order to make a great infographic, you really need to understand some very complex concepts very well and then break them down into their simplest component, which I think is a very specific skill.
Thanks, Ben. I think before we dive into how you design your infographics, as you mentioned, kind of there is now increasing this trend of increasing use of infographics. And tell us, why is that? Like, why people are preferring infographics over traditional, like PowerPoint or any other media or communication? Why there is this increasing use of infographics?
Yeah, I think that's a really interesting question. I was at a APLS conference yesterday where the Predict group, which is a large conglomerate of pediatric emergency research teams, was really highlighting that when they were looking at their research now and looking at their output, they very much wanted to emphasize that their work was not done until it was effectively translated to clinical practice. To me, this rise in interest in infographics is related to two things. So one is that increased cultural emphasis on research translation. And two is I think there's been some democratization of the technology. So there's more user-friendly software out there now that allows some non-artsy people to create infographics fairly easily that look quite nice and professional and can harness sort of the important factors for an infographic that lead to good research translation. I think with regards to that emphasis on translation, I saw a tweet from Ross Fisher the other day who was quoting Sir Mark Walport, who said, "Science is not finished until it's communicated." And I think it's such an important point. And certainly that was the reason that I got really interested in the Simulcast Journal Club, was actually realizing that there was this huge volume of research on simulation literature out there that I had no awareness of even existing, let alone read. And it has been so transformative for me reading that stuff. And I really love being able to link people to research that's out there that's been done well, but hasn't necessarily been put into the right hand to actually, change the world in different ways, I guess. I think as a researcher, it just makes sense as well. I mean, if you put all this passion and many years into your PhD or into something that you really think is important, it makes no sense for that to be sitting in the university library and not being acted on. So I think it's very important. I think infographics really help with translation, and specifically when done well, they can definitely increase your researchers' altmetric scores. They can increase site visits to new publications, and hopefully they can ensure that there will be more interest in the concepts that you promote. I think they're great conversation starters. And in a lot of ways, I think they can kind of be viewed as a sort of speed date or a gateway drug that you hope will really lead to a more meaningful connection with a reader or learner further down the line. But I do have some hesitations about them as well in some ways.
Thanks, Ben. I guess you hit quite important points there. Now, one of the things that I kind of started seeing now, even the big journals like JAMA or New England Journal of Medicine, they also started putting infographics out there for wider dissemination of their research. And I guess getting your research published in even the big journal is not sufficient. And I think every journal is using this strategy. But do you think, is it just a wave, or is there really a strong evidence in support of this modern pedagogy?
Yeah, I was so glad when you emailed me this question, because I think it is more complex than we've maybe let on. And I think there are potentially elements that will be a wave, and I'm not sure that they will be as emphasized in 10, 15 years. But I think they are a very useful tool as long as we know why we're using them, I guess. So your question sort of prompted me to look at a couple papers. Would you be all right if I went through a couple of the big learning points from them?
Of course.
So there was a paper called Exploring the Role of Infographics for Summarizing Medical Literature. It's by Lindsay Martin et al. In the University of Saskatchewan. It was published in Health Professionals Education. And in that paper, they recruited Canadian emergency physicians working in Saskatchewan and surveyed their response to 8 article summaries. So 4 had infographic summaries and 4 had plain text summaries. And in phase 1, participants self-rated the mental effort they invested in reviewing the summaries and indicated their preferred summary format. And then 4 weeks later, they were tested on information retention via 2 free recall and 2 queued recall questions per article. And look, if you're an infographic fan like me, the results are actually pretty disappointing. So some stuff makes sense. So people like infographics. That much is very clear. So they rated and preferred infographic summaries to traditional text-only research abstracts. And they rated that their mean mental effort during the summary review was lower for infographics than for text-only abstracts. So they liked it and they found it easier, which makes sense in a lot of ways because the brain is much better at digesting and interpreting and filtering a large amount of visual data than it is designed to filter and digest a large amount of text. Yeah, so it just seems to, from an evolutionary perspective, work for us more simply. But there wasn't any statistically significant difference in delayed information retention. And so I think that's an important point. This was a useful tool in terms of people liking it and finding it less difficult to digest information, but it didn't lead to better retention than a usual traditional abstract summary. And as part of a pigeon pair from that study, there's another one also from Canada. So the Canadians seem to be pretty into their infographics. And this one's called The Effect of an Infographic Promotion on Research Dissemination and Readership, a randomized controlled trial by Simon Huang et al. In the Canadian Journal of Emergency Medicine. And in that one, they took 24 articles that were chosen from that journal and then randomized them to infographic or control groups. And then the articles were disseminated through the journal's social media accounts, which was on Twitter and Facebook. And control articles were promoted using a screen capture image of each article's abstract on the journal's social media accounts. And infographic articles were promoted similarly using a visual infographic, and abstract views, full text views, and the change in altmetric score were then compared between the groups. And what's kind of depressing about this is that abstract views were definitely higher in the infographics. So they are quite a good gateway drug in terms of luring people in. They're pretty, they're interesting, and they will get people to come and click on the article. So there was a mean change in altmetric scores with infographics. So people were discussing the paper on social media more. But there was no difference in full text views between the infographics and the control groups. So actually, more people were talking about the paper, more people went to the site, but there wasn't actually an increase in people accessing the full text views. And that to me is kind of heartbreaking. It also suggests to me one of the big risks of infographics and medical education through social media. And that is that I think in some ways we do run a risk when we're translating effectively at creating a sense of sort of shallow scholarship. There is a real, to me at least, a really huge hunger for pre-digested, synthesized information. But there's a lack of acknowledgement that actually it is often the reading, the digestion, the thinking about a paper for a while and discussing it with your colleagues about the pros and cons, and you actually having to synthesize it yourself that actually leads to long-term nuanced learning. And so I worry sometimes that people are taking these haiku summaries of big papers and then kind of feeling like they've done the work and they don't need to read the paper and just reading the summary is enough. And I think in some ways that's clear that that is effective in that people will be talking about your message, people will be talking about your paper, but they won't necessarily know the nuance behind it. And so there's risk in that. So I think for me, it's important when we're thinking about designing infographics, really having a deep think about whether it's the most appropriate tool, whether you've got a clear, synthesized, and simple message, and what your actual goal of having an infographic is. Because we have evidence that people will like it, we have evidence that people will share it on social media, but we don't have evidence that they will learn or understand the concepts you're teaching better than if they read the paper. So you've really got to think very carefully about the design of that stuff, in that infographics are at their heart inherently reductionist. A good infographic minimizes text, gives you a good kind of snap feel of understanding and kind of an aha moment about a particular concept, and will give you the really nice quick cliff notes of a complex concept. And hopefully that would encourage you to read more. But in some ways, they're a little bit of educational fast food. So if you have a message that is concise and clear and you want to get out there, I think infographics are a really great option. But I think we've probably got to think a little bit more cleverly about how to use infographics rather than just assuming they need to be attached to every article. What do you think, Swapna?
Absolutely. And I'm really glad that you actually mentioned those points, because initially I was thinking that you are an infographic fan, so you are going to convince all of us to follow infographics blindly. But I'm really glad that you mentioned the darker side of the infographics, because what I'm worried about nowadays is my registrars, they come up with this infographic and then just highlight the conclusion of the trial to me. But the real beauty of the trial lies in the methodology, and actually it's almost like that lost art of how to interpret a trial and how to analyze a trial. And I think that art is probably getting lost in translation, especially when people are just looking at the infographics and simplifying the trial too much. And I guess when you do your simulcast podcast, you know that how much efforts you have to put in to prepare a one journal article. You have to really dive deeper into the methodology and strengths and limitations. And I think the infographics somehow limits that process for the readers. Obviously, it can be a very gaming tool for researchers to get their altmetric scores high up and get their profile high up. But I guess from the reader's point of view, I still kind of a bit cautious about using infographics and relying on them to change my practice. And I think that's the worry that I'm facing with my learners, that they sometimes they tend to change the practice based on the conclusion of the trial, which is presented via infographics.
Yeah, look, I absolutely agree. And I think it is challenging. I do love infographics. I find them useful for myself to synthesize information and process them and think about how can I make an analogy or a visual image that demonstrates this concept well. I know that Jesse, when he spoke to you about social media networks in general, mentioned this concept of utilizing social media and in terms of, I think it was like embassies, home base, and outposts.
Yes.
And I think to me, that has helped me frame my understanding of infographics, in that it is in many ways, it's quite a good breadcrumb, but I cannot rely on it for people to come and eat the whole meal. So I certainly know if I make a nice, pretty infographic about a new paper, then what will happen is that I will get vastly more retweets, which is good. Like, that is a useful thing for me because I need to attract people to my journal club. And if they're not talking about it and not noticing it, then they won't come. But once I have attracted them, I still need the hook to get people to come and contribute and do the slow scholarship of reading the article and processing it. So I think it is a useful tool. But what I would say is I attempt less now to synthesize a full paper into a picture, because if I do, I'm potentially defeating my own purpose. And what I want to do is give people a little aha moment to recognize, hey, this is an important concept and maybe I need to go read about it further. One particular strategy we did, we created a group of open access simulations recently on pediatrics. So we were doing one on SVT, for example, and we really wanted to provide some infographics because I believe very strongly that infographics are a useful way of translating the learning from the group who participated to the rest of the department, and also of helping with germane load post-simulation, so helping people process and storytell and fit their learning within a narrative. So we created some infographics to be sent out either before or after, depending on the facilitator's preference. But what we realized is that in addition to just wanting to sympathize the key points, so we did one on treating neonatal SVT, we really wanted to continue to draw people into further learning. So we embedded some QR codes with the hope that if people scan them on their phone while they're, say, looking at a printed out poster of the infographic, it will take them to a real-time demonstration of a particular skill. So rather than just trying to have the infographic be a single point of information synthesis. We've tried to use it as a portal, I guess. So here is the basic concepts. And if you want some just-in-time training on these particular skills that people are not particularly good at, then you can utilize that in a different way. So I think we will continue to learn more about how to use these tools well, but I think it is easy to go into it with a passion for just translating the conclusion. And I agree that the devil is in the details and that we're not necessarily helping ourselves by doing that.
Thanks, Ben. I like the way that you are using it as a complementary to your other pedagogies. Say you are using it to attract more listeners to your podcast where you are discussing the paper in depth, or you are using the infographics as an assistant tool to your simulation so that your participants can learn more. So I think what I'm hearing is more of a added pedagogy to your kind of main pedagogy. Is that correct summary?
Yeah, absolutely. It is a useful tool in your utility belt, and particularly it generates interest. People like it, and that is not a bad thing. That is a useful skill to have, to be able to generate interest in a world where people are overloaded with information. To make yourself stand out is important and helpful, but it is the first part of the job. It's not the end of the job.
That's right. As you mentioned, you are trying to increase the germane load and not to increase the extrinsic load. And I think that's a very important takeaway from that conversation. That's a nice segue into the next question. How do you design your infographics? Talk us through your mental process in designing infographics.
Yeah, sure. So it will depend a little bit on the message, but this was actually a useful question to make me think about how I did it. The first thing I will ask myself is, why am I doing an infographic? And options will be, am I doing this out of passion? Is this just an idea that I think really changed my practice and I want to share? Am I leaving a path of breadcrumbs to draw learners in somewhere else? And then is it a good idea to share via infographics? So is it a simple idea that I can share with as wide a group of people as possible? Am I doing it because I want to accrue social capital? Am I trying to do this to get interest on social media or Twitter and accumulate an audience? And I don't say that as a derogatory thing. I think that creating an audience gives you power to transmit a useful message. So it is an important part of the tool. And then I'll think about, is my message appropriate? So there are some messages that are too complex for an infographic. And because you have to be reductionist, you have to synthesize and simplify and cut out every word you can. There is a risk that people will misinterpret what you've said, and then you have potentially taught people the wrong thing. So you've really got to pick the right message and think a lot about that. When I think about the message that I want to send, and that will usually be most of the work, I'll often spend a few weeks just sort of umming and ahhing about how best to represent it. I'll really try and teach, when I'm working with my fellows, for example, what is the simplest, purest message that I can give people that still retains its heart and still retains its core components. And that in itself, I think, as a learner, is a really useful exercise. And certainly with my sim fellows, for example, we work really hard at trying to go, no, that is too much data. Come back, synthesize. What do you really want your learners to learn? 3 big things. If that message is safe, then I will then start to think about really a way that I can create a visual analogy for those core concepts, trying to give a bit of a aha moment to the core concept. So if there is a metaphor or an analogy that might fit, if there is, what would be the other option? I would say that, if there is a humorous way or a way that you can create some visual flair or satire within an infographic, that will often create a lot of interest. People, humor is a great gateway to further learning, and it's very good at flattening hierarchies. And then I'll usually just draw a basic outline on paper. And then for me, I actually remake my drawing then on Adobe Photoshop and Adobe Illustrator, and I create a JPEG, and I just save it and share it on social media. So I think a lot of the work is actually in the design, in thinking about what is my message and how do I synthesize it. And then fortunately, there are some online tools that people can use to help them create an infographic if they want to without having to learn a complex program like Photoshop.
Yeah, so obviously the Adobe Photoshop can be tricky to learn, I guess, but there are some softwares. Do you recommend using those softwares, or what's your experience with them?
Yeah, well, I guess because I was very familiar with Photoshop, so I tend to use that because that's just my comfort zone, and I like to control every pixel when I want to. Certainly, my fellows have liked PictoChart and Canva, so Pikto chart.com and canva.com as quite useful and pretty approachable, user-friendly online tools to create some really good-looking infographics. So it is definitely a doable task for anyone now to log on to one of those sites and make something that looks pretty good, looks nice and professional. The real job is to synthesize your message.
Great. Now, if budding educators want to learn about this novel pedagogy and they can't go to College of Arts or animation school and learn like you,
Well, they could.
of course they could, but
It's not
obviously
too late, Swapnil. It's not too late. You can do it.
that's right. Thanks, Ben. That's the last thing I want to do now. But are there any simplified resources available to learn more about this pedagogy?
Yeah, absolutely. So, look, the first thing I would do is recommend a couple of people to follow on Twitter. I'm sure there are many more, but two sort of stars we have in Australia would be Grace Leo, and her Twitter handle is at GRACIE_LEO, and Charlotte Durand, who is at CHAR_DURAND. And they are both very talented training specialists who spend a lot of time both helping facilitate conferences, but also do a lot of work in terms of visually translating a lot of the talks that they go to. So they have a lot of street smarts and a lot of experience in demonstrating complex concepts in different ways. And it's worth just having a look at their style, seeing how they do it, seeing what you would like to use from them or how to change it. Grace has a website called adventurousgrace.com where she teaches about a lot of sort of just more basic understanding for medical educators about utilizing visual space and visual techniques effectively in all kinds of presentations. If you're looking for some other good examples, the canadian.org website has an MVP infographic series, and they are all very high quality infographics and very useful to just go through and look at the techniques that they have used. And those would be the big ones. If you'd like to check out ours, if you go to Don't Forget the Bubbles and search for Practice Makes Perfect, we've got 7 simulations there. And I guess the ones we're most proud of would be if you download the SVT simulation package, you can check out the way that we've incorporated QR codes to sort of link people to future learning.
Great. And are there any workshops or like short courses that people can undertake?
Oh, I don't know, actually. I know that the Academic Life in Emergency Medicine Faculty Incubator definitely has extensive teaching on it. So that would be one to look into.
Maybe you can start one.
Yeah, maybe. The other person who's a real master, not so much of infographics specifically, but really just this concept of demonstrating complex concepts visually in a simple but eye-catching manner would be to look at Ross Fisher's stuff as well.
Of course, yeah, I'm a big fan of Ross Fisher.
Yeah. And
that brings to next question. What's your advice to budding educators?
Yeah, that was nice and broad. I found this question really challenging. Look, I think to start with infographic stuff, I think they're a great way to share your passion for a topic. So really have fun, play out with some free online software, and really just see what you can come up with. And even if it's just for yourself, it's a really great way to really reflect on and process a paper or a piece of information that you want. I actually started making infographics from every week in med school. I would get an A3 piece of paper and just draw out the week's learning in different visual ways. And for me, it was a really useful exercise in and of itself. I think I really want people to think hard about the risks versus benefits of any educational intervention. And specifically for infographics, think hard about the risks of promoting shallow or fast scholarship. And if you can, try and share knowledge in a way that deepens processing and information sharing, rather than just excessively simplifying a message, which is not easy to do. It's an ongoing challenge and one that I struggle with as well. I think infographics in particular are a really great way to set yourself apart from your colleagues and build an audience. But in the waves of attention you receive, And this might be a little bit controversial, but one piece of advice I want to give budding educators is that sometimes when you stand out, you may actually run into some people who are keen to commodify that passion in a way that doesn't treat you the best. So I think really it's really important to value yourself and make sure that you're happy with the agreements that you're making with people, in that this is often comes from such a place of passion that it can sometimes be taken advantage of. If there was one piece of advice I could give people in general for budding educators, it would be that the journey to expertise really starts with reading, and that all the bells and whistles that we have, I think there is so much power and importance in just sitting down, doing the work and reading the papers or reading a textbook, and it is one of the most transformative things that we can do. And when you're looking to process that information, there is this wonderful, amazing network of online educators in multiple virtual communities of practice who are keen to help promote their own teaching, but also help you process and work through understanding some really transformative stuff. And it is just the most wonderful journey to go on. And so harness that passion and just embrace where it takes you.
Thanks, Ben. I think that's such a great advice. And I guess you mentioned the important concept of networking in medical education. I don't think there's anything better self-directed learning than networking. I guess once you start networking with amazing people, you learn so much from them.
Yeah, it is just incredible. And also just the generosity of the community that's out there. Academics can seem sometimes like very remote celebrities, but it's quite phenomenal how easy it is to connect to them and share their passion for what they've promoted.
Absolutely. And so if budding educators want to contact you, or if they want to ask more questions on this topic, or they want to learn further about infographics, what's your best contact details?
So you could either contact us by making a comment on the Simulcast blog. So if you go to simulationpodcast.com and make a comment on any of the journal clubs, believe me, I will be listening because I have to edit and approve them all. And I'm also available on Twitter, so at SYMON_BEN, and always happy to chat and share some advice.
Great. Thanks, Ben. Thanks for your time. I'm pretty sure you started this conversation and a lot of people will learn quite a lot about infographics from this podcast. Thanks again.
Yeah, great. I hope so. And thank you so much, because I learned a lot more from having you ask these questions, and it made me go and read up and process some things that were happening on a subconscious level that I hadn't really processed. So very grateful for your time.
Thank you. So that's the end of our today's episode of Educators Podcast. Please don't forget to leave us a review on iTunes. Also, make sure that you subscribe to this podcast on iTunes, Spotify, or any other podcasting platform. We'll be back in month's time with another episode of Educators Podcast. Till then, goodbye.